This episode of Ladder Legacy is proudly sponsored by the Bedford Group Insurance, helping families and businesses protect what matters most. Whether it's coverage for your home, your family, your team, or your future, Bedford's got your back with the best reliable insurance solutions in Florida. Visit our website to learn more, bedfordinsurance.com. And now on to your episode. Hey everybody, this is Rudy Romero with From Ladder to Legacy, and I am here today to welcome to the podcast Dr. John Hinson, a board-certified orthopedic surgeon specializing in shoulder and elbow care. His expertise includes sports injuries, rotator cuff repairs, and shoulder replacements. Dr. Hinson, thank you for coming in and joining us today. We appreciate it.
Yeah, I appreciate you having me on.
So first question I have to ask is sports injuries. Who can you talk about that you've worked on? Because we'd love to know, of course. Obviously, there's HIPAA and all that fun stuff. We'll call it teams we may know, or any geography that we may know so close to that, so you're not obviously giving any patient information.
Absolutely. In our area, the most common high-level athletes that we're going to interact with are golfers. I mean, we're a county that's rich in PGA golfers, and so it comes up along the way that you get a call and hey, so-and-so has this or has that. And much of this stuff is wear and tear stuff. Fortunately for their sport, they do get some overuse wear and tear injuries, but typically not catastrophic level injuries. And so that's probably the biggest group we've taken care of. We have our minor league representations, our spring training representations here. So those guys, and then even some of their farm system players through the course of the year wind up getting seen in the clinic. And then, to be honest, the injuries I probably have seen the most have been Hall of Famer retired guys. And so
Really?
We've got some very gracious Hall of Fame athletes that live in our county it's funny. You're kind of going through your day and you look up and you realize that, holy cow, that's that guy sitting in front of me or having a conversation with me. And I've had a couple of fun interactions. And to be honest, my interactions with those guys have been actually very good. Again, very gracious guys who have been in the spotlight a long time and continue to be very warm and generous with their time. And this probably the specific one that just as a generality, a guy who is a Hall of Fame major leaguer who happens to be a family hero. And he very graciously brought me a signed baseball back to clinic a few days later. I mean, what more could you say about the guy? What a great guy. And so, yes, it's neat. We get to have some of those interactions. It's fun.
Yeah, that's amazing. That's what makes, I think, Palm Beach fun, right? Is you get to have different sports. We just had obviously FIFA down here for the World Cup, and talking about golf, and no one ever thinks really golf as an injured sport, right, or a sport where injuries occur. But like you said, I mean, there's a lot of rotation and movement. So, with that said, what drew you to orthopedic surgery, specifically shoulders and elbows? What kind of got you started there?
Absolutely. So it's funny. I had some medicine in the family, and I have a sister that's an internist. My mom was a nurse. And as a really young person, thought, oh, wow, okay, I can kind of follow my sister's footsteps and go kind of this primary care path. And then had what turned out to be good fortune to go get a job in the operating room, truly as an orderly. I was mopping up the blood, moving patients, doing the lowest level job in this OR, and absolutely changed my life. I mean, completely fell in love with the atmosphere and what we get to achieve and accomplish, and having that hands-on approach in the operating room, the hands-on approach to medicine. And in my initial exposures to the operating room, my closest relationships were with general surgeons, and thought that was maybe the route I wanted to go. But as I got to medical school, was fortunate enough to do very well and be in a good position academically and have a lot of open doors to me, but realized that the thing I really liked was surgery. And what I mean by that is in our orthopedic realm, we're spend a lot of our time looking at things through a surgical lens. Despite the fact that we only operate on a tiny fraction of the patients that we meet, we still are looking at it through that surgical lens and how we're going to approach the anatomy and their structural problems, versus what I realize the general surgeons actually are taking care of ill patients and have a very important job and do great things, but they spend time taking care of patients that are in poor health and have a lot of problems going on. And it is very vital, but I found myself much more drawn to the orthopedic realm. And I think, I'm obviously biased, it's very easy to be drawn to it. It's hands-on. We get to play with great toys and great tools. and we have these very tangible results. And so the surgeries I do a lot of, a rotator cuff repair, where you have a torn tendon and you go in, you identify it, you clean it up, you repair it, and you finish your case looking at it like, wow, that tendon was torn an hour ago and now I've put it back together. Shoulder replacements where you go into a very arthritic joint and come out an hour later with a joint that's completely brand new and replaced. Fractures, the same kind of thing. Broken bone comes out fixed. And so you really come out of your surgeries with this very tangible outcome that you can really kind of feel immediate reward of what you accomplished, and then you get to walk your patient and help them get through the recovery process. I wound up getting drawn to shoulder because it really feels to me like a microcosm of our field in general. I do a lot of sports medicine. What I mean by that is soft tissue, arthroscopic work, so things I do through a scope. And that's the lion's share of what I do. But I also do a lot of joint replacements, and I get to do fracture work. So I get to focus on a joint or two, but get the whole spectrum of orthopedics, sports medicine, fracture work, and joint replacement, despite being focused on one area of the body. And it really gave me a niche that it keeps me interested in, and really am very, very fortunate that it's something I really, really love and find a lot of pleasure and continue to be enjoying 16 years into a career.
Wow, 16 years. And I want to make sure people don't gloss over something that you had said, because it can be easily glossed over, but you worked as an orderly. I know that sounds so funny to go back to that one thing out of all the things you just said, but somebody who actually worked in the OR before working in the OR, right? That is an amazing thing, because a lot of physicians, and I have a few friends like everybody else who's in the business, and most of them don't do that. Now, and I know it's a weird thing to focus on really quickly, but what made you want to do that first? Because I know it makes sense in my mind, right? Start from the bottom, see everything, understand it, get the feeling of the OR, get a feeling of what surgery looks like, feels like, smells like, right? These are all things that come with the job, right? To create tangibles. But what kind of pushed you in that direction? Because I can tell you that is not say it's not normal, but it's not typical for most physicians. So it's an amazing thing that you did do to get into the business first.
Well, it's interesting, and it's something that I will openly share with people, and I've even occasionally shared with a patient in the right scenario. I was finished with an undergraduate degree, but not ready to start medical school immediately, and a biology degree. Well, it doesn't open that many doors for you. You can go teach, you can go do some jobs, but not jobs necessarily exactly in the field I wanted to do. Wanted some interest, wanted some experience in medicine, and knew it was a full-time job that would get me in the hospital, and didn't necessarily realize that I was going to be drawn to it. It was just like, hey, this job's open and it's in the medical field, let me go do it. But as I put it a minute ago, truly a life-changing experience for me, and it really helped focus me. And I was, like many young people, a little on the immature side, not totally focused on what I was doing. And when you got in there and got your feet wet and realized how passionate I was about it, it really drew me in. And then when I got to medical school, it was like I found my spot. This is where I'm supposed to be in life, and was very fortunate to excel and do very well and have a great experience, learn a lot, have a lot of success academically, and it opened the door for me to do this. It's a competitive field. You need to be in good position to be able to match into the orthopedic residencies, but I was able to do that successfully and set me up for a good career.
Now, and it's interesting you say it that way, not ready. And I think there's anything wrong with that, right? We all have to be at a time and place in our lives where we're ready to take something on, right? That's what life's all about, is figuring out Absolutely. When the right time. Because everyone says it's about how hard you work. It's all these things, luck, timing, and ability, right? That's what creates doors. So it's interesting you say it that way. Now, is that in high school? Were you a 4.5 grade GPA student, the guy who was on the wrestling team and had was a part of every club? Were you that type of kid back in high school, or a little different? And I ask that because it helps the viewers understand that there's more than one path, and people they think you have to be the captain of the soccer team, and you have to have a 5.0, and you have to have this, and you have to have that. But that's not necessarily true.
No, and it isn't. And I think that's important for people to realize, particularly when you have children. I've got 3 children, and one is a rising 9th grader, and the stresses and the expectations that are put on the smart kids are, just really hard to wrap your head around, that that she's worried about whether she needs to take an AP class as a freshman in high school, and her GPA needs to be above 4.5. And it's really, I think, almost unfair for these kids to have that level of pressure. And our we live in a wonderful state where our state university system has really advanced over recent years, but it's come with rising standards that just again up the ante on these young people to try to achieve things that are almost unrealistic, and many of them do. It's really impressive. You look at these kids in their high school transcript, and it's like, you've done all this and you're 17 years old. It's really remarkable. And I have a young man shadowing me right now. He's telling me the things that he's got going on, and it's things that some people don't even accomplish in the whole lifetime. He's a very impressive young man, and he's doing this by the time he's done with ninth grade. And so it's really a lot. And back to the question, I was a good, well-rounded kid. I was very, very involved in sports. I was a high-level swimmer. That was means that was a 5 to 6 hour a day commitment of athletics, and did fine academically, but wasn't a 4.0 student. I had very good test scores, and it's one of those things because of where I've gone later, and where the achievements I've had later, and the things I could show as my track record academically as a med student. Well, in hindsight, look back and admit I wasn't the most focused high schooler. And the thing I would tell to the young person graduating or as a senior in high school and has, maybe not the grades they were hoping for, that's okay. You haven't closed any doors in your life. As you realize where you need to be and where you want to be, you take the paths that are open to you. And I'm fortunate enough to have a son, actually, who's an undergraduate at the University of Georgia, he's a perfect example. This is a kid who was a very unfocused high schooler, and yet he got finished with high school, went to the local university for a year, did excellent academically, is transferred to the University of Georgia, which is his dream school, where he wanted to be, and is doing very well academically. And you need to, as a young person and as your parents, okay, I'm finished with high school, but maybe don't have the great transcript that I want. Take the paths that are open to you. You can do everything you want. You can start at community college and go to medical school. You can do just about anything you want. There's very few times that the doors are really shut. So you just keep trying, you keep working, keep your head down, and you can succeed. And I think I'm a perfect example of that. And it's very different. The culture of getting into college is very different from the early 90s when I was doing it, but it's not that different. I mean, there's still plenty of ways to achieve the same goals, and we're very fortunate to be in a state that you really still have a lot of avenues. And now with the increased number of medical schools from when I was a young person, the ability, whether it's medicine or whatever field you want to really succeed, no matter what your starting point is.
I love that. And first of all, I appreciate you saying that, because there's people on here, listeners, young and older, who, may decide to go back to college, right? Go back to follow their dreams. And I think it's wonderful that you hear a physician that have that type of mindset. I'll be honest, again, it's not very often, just so the listeners understand that what Dr. Hinson here is saying to you is it should be impactful into your life, right? He's telling you there's options out there. You can't. I know we kind of dive right into, got real serious really quickly, but in a good way. Talk about a guy who is taking the time to be here today to have this conversation, talk about himself, talk about his past, and tell you there are more than one path. And that is an outstanding thing to hear, that's the case, because you don't have to be perfect. And I think they call it practicing medicine, right? It's not perfecting medicine, it's practicing it, because it's a practice every single time you work on it, right? Which is part of, you becoming board certified, I believe, in 2012. How has that made you, or how has that changed you since you've, got your board certs and kind of went down this path and, went from a kid who may have not known what he wanted to doing such an amazing work on pro golfers and all these other people you've been working
with? Well, it is in ways to ensure the quality of orthopedic surgeons in our country. There's a lot of steps to get through there, and I had the experience to be on the faculty at Medical College of Georgia for 5 years, and it really opened my eyes to the quality and the level of people that go into my field. As you sit on the faculty side and look through the list of applications of these guys that are applying for our program, it is this laundry list of guys that are absolutely superstars in their life and have these track records and academic records and scientific successes and athletic successes, military successes, and And that's just the first step. And then they get into 5 years of training. And then in an effort to ensure that there's not, someone slipping by and gotten through 5 years and not prepared to take care of people. After you're finished for a year, we go into a period where we have 6 months of what we call board collection. Every case you do, every person you touch is put into a file and submitted to the American Board of Orthopedic Surgery. They review all these cases for 6 months and they select it. My time when I did moral boards is they selected 12, and then you were able to go through and take out a couple of cases. And then we still do it. And I have a partner that's Monday doing his oral boards, and we all still go to Chicago, and you sit down in front of 3 different panels of orthopedic surgeons who have your case files in front of them, and they review the whole case for you. And they want to know everything about the case. They can ask you from the most basic science fact of the case to detailed medical facts about the case. And it's really wanting to ensure that your thought process is sound and the way you're thinking through it, the scientific approaches you're taking are all sound, and ensure that people like me are out there doing a good job and giving people quality care. So, and for me, it was the culmination of 16 years of work. And then as I was finishing training, and you say it out loud, you're almost left laughing. Like, did I really just train for 16 years to become a surgeon? I mean, it is almost hard to wrap your head around that it's that kind of time commitment. But that board certification truly is the thing that you're left going, I kind of made it. I've got my certification I can hang on the wall, and is the tool that really sets you up to be out in practice and being, particularly like a community like ours, a big community where the expectations are you are a quality practitioner and are going to provide and meet the standard of care that people want in their life. And that's it. When you get that certificate, you feel like, wow, I'm there. I'm prepared and ready to do that.
Of course, yeah, and I think that's amazing. Again, even just getting the boards, right? They're just so difficult, like you just spoke about. Most people think it's just hey, you ask me 1 or 2 questions, but no, it is not. And you take 16 years, like you just said, a culmination of your life. How many people watching this have done anything for 16 years together, right? Never mind done anything for 10 minutes because our attention spans can't hold. So to take 16 years and dedicate your life to something like this, it's amazing. So what does a typical day look like for you at Palm Beach or Orthopedic Institute? What does it look like? Is it easy? I'm going to guess it's not. You're wearing scrubs right now, right? So I was just joking with him before the show. And so I'm sure you're probably over there trying to get things ready and jump into the next thing. But, what's a typical day look like?
Well, I've over the years tried to hone some consistency and efficiency into my day. I typically try to build in 1 or 2 days of full OR days, and there's a little variation. Some people don't want to have a full day of OR; they like to break it up a little bit. I find that one of the least efficient times in my day is the time I spend in my car getting from point A to point B and around places. So if I can get all of my cases done in one facility in one day rather than breaking up into separate days, I just think that makes way more sense in my life. So I'll do typically 2 dedicated OR days and 3 dedicated clinic days, but it's not necessarily as consistent as that. This week we operated on Monday, Wednesday, and we're operating again this afternoon, and then clinics Tuesday, Thursday, Friday, and that's a fairly typical week. Now the days can run long. Both Monday and Wednesday days that start at 7:30 in the morning ran well into the evening as we're getting cases done. But it's like most people, I have a family, and when you get home after dinner time, that can be taxing. There's no way to kind of avoid that point. It is what it is, and I'm fortunate to have a good supportive family that recognizes the value of what I do and the importance of it, and knows they need to have some flexibility.
Well, yeah, I think there's a misconception that, physicians just are on the golf course all day, right? Or they're at a convention, or they're, they're sitting, walking, or taking rounds, like the white jacket on, they're just walking around in circles answering people's questions, right? That's not the case. You're working. I used to speak with a very good friend of mine who went through the VA system, became a physician, and he told me, he works for less than minimum wage, right? Especially during residency. And it's, very much thankless job, and people don't understand. I think there's misconceptions on what your day-to-day looks like. And, first of all, thank you for the work you do, because I think people should be appreciative and understand how much you give up to be able to help put people back together, because that's what you're doing. Orthopedics, like you had talked about, a little different than surgery, right? A little bit more rudimentary in some ways, very advanced, but there's still a lot of things that you do. And I'm sure you could talk about it more than I can, that are very, may look barbaric to some people because of the way you have to manipulate and move joints and, change, you know, rotator cuffs, and you're working on elbows and arms. And these things are not just, delicate little pieces. They're large pieces of the anatomy. You're talking about a femur and resetting joints. I mean, I don't know how you work on hips, or if you do anything with the hips as well, but that's a huge amount of work. I've seen some of the R footage on it for stuff that's been put out. It almost looks like they're pulling people apart, but that's what you have to do. That's part of it. So it's amazing the amount of time and dedication that you put into it.
The thing I really enjoy about what we do specifically is, like most surgical fields, it's 90% finesse. But the fun thing about orthopedics is about 10% getting to knock the heck out of something. And it's fun, I mean,
Yeah.
we're using power tools. We're putting big broken bones together. I do a lot of hip fractures, and these are people that typically are older people that come in truly unable to walk if their fracture is not fixed. We fix their hip and literally get them back on their feet, and get them back to their life. And I mean, what how rewarding is that? I mean, it's really enjoyable to get to see the results. I mean, I love what I do in the operating room, but it is awfully nice to get to see the feedback from patients and get to see the person who you met, on their back on a stretcher in the emergency room, who is, been in clinic and back to their life and back walking and back to their family and their grandkids and the things that they want to be doing. I mean, what more could you want out of a job? It's really, really a rewarding and fulfilling career.
Yeah, and I can imagine it is. It's got to be fun. I mean, you have to be in it for 16 years. It has to be drawing you to something, right? There has to be something
Absolutely.
that makes you excited to come back every single day, waking up early, getting home late, dealing with the family unit. Has to be something that compels you. So what are the most common, shoulder injuries or arm injuries? I know you talked about rotator cuffs, and you talked about obviously the older geriatric community, as well as some of the pro players and all that. But like, what are some of the common concerns you see? And then also, what can be prevented on some of these things? So some of the common things you see, as well as, hey, if you would have done this, maybe warmed up, maybe did some stretching, maybe, didn't push that shoulder as much as you did, as many times as you did, could have maybe prevented some of those things.
Absolutely. I mean, the most common things I see as a generality are going to be degenerative conditions. The reality is, while we see, particularly in our community, we see a lot of youth baseball players, we see young athletes, but there's still really a fraction of who we're going to take care of, because the meat and potatoes of my practice and people like me is going to be the 50-plus-year-olds that have degenerative conditions. And in the shoulder elbow realm, rotator cuff disease, rotator cuff tears is the most common thing we take care of. And it's very frustrating for patients. Many of them are 55, 60-year-olds, very frustrated. And the big question on their mind is why? And it just, have to ultimately wind up telling them this is something that's happened as you age, and there probably wasn't a lot you could have done to prevent it. I get a lot of opportunities to take care of 65 to 75-year-olds who have a little bit of wear and tear in their shoulder, and they're seeing me, and we get them better. And in that preventative realm, I'm just giving them some basic advice. Hey, keep your shoulder strong, keep that shoulder girdle strong, be a little smart and common sense in your approach to things. We're all guilty, whether you're 25 or 75, of being impatient and putting ourselves in a bad position positionally, and where we're doing things with our body. And those 65, 75-year-olds, I'm just telling them to be deliberate and a little bit cautious in the way they pick up and lift things, and they can go a long way. Because those who do have injuries, is so many times that it is something that they're sitting in front of me going, if I just, taken one more step, if I just not, had that loose thing on the floor, just little silly things that we're all guilty of doing that lead to a lot of the injuries that we see, and prevention can go a long way for those people.
Yeah, and that's, I think, what you said, prevention, right? Because you can't. It's impossible, like you said, if it's a genetic thing, or you've heard something over time, or maybe it's an injury you had as a kid. I love the theory of, hey, when you get hurt as a kid, you may not feel it, and then 40 years later, you start remembering, hey, that knee I sprained back when I was 15 years old, starts to come back to say hi to you again, right? And trying to make sure you stay as into the world with gyms and going out and actually, exercising, right? Because I think that's probably a huge preventative, right? Is keeping your body in motion, right? Something in
Absolutely.
rest takes a lot more work to put it into motion than if it's already in motion, right? I think someone said something like that many, many years ago, some smart guy. So, the question is, what are some good things that, we'll call our geriatric patients or older patients could be doing to kind of just keep things limber? Is there any recommendations, physical therapy they should be looking at, or what are your thoughts?
Yeah, absolutely. And so in that particularly in that geriatric group and population, the things that I'm going to focus on with them, and it'll be a little bit. Some of this will be a little interesting coming out of a shoulder elbow guy. I've already had this conversation with an older patient today. Listen, if we in our 65, 70 plus year olds would keep our legs and our core strong, we would see so many less injuries, and including a lot of these hip fractures we see, and then even some of these shoulder injuries, these falls that lead to shoulder and upper extremity and wrist fractures. These, as we age, we get weaker, we get some balance issues, and if we could just keep our legs, and even more importantly than keeping your arms stronger, is just keeping your legs and core stronger. Really, it would prevent a lot of these falls. And the same little stumble that a 25-year-old just walks right away from, is just on with their day, doesn't even think about it, leads to a fall in a 75-year-old. And it can have catastrophic level consequences. So just that basic tenet would go a long way. And then specifically for our older athletes. And that's a real thing, particularly in our county, is just because you're 75 doesn't mean you're not an athlete. And we really take care of a lot of people in that setting. I've seen somebody just this week in clinic in her 70s who says, I golf 6 days, I play tennis 6 days of the week and golf the other day of the week. And if that's not an athlete, I don't know what is. And she has some relatively minor issues with her shoulder that were bothering her, and going to set her up on on a rehab program. And what I'd love to encourage her, look, get that shoulder stronger, keep it stronger, do this on a maintenance basis, warm up before you play, make sure that whether it's a tennis racket or a golf club or whatever your sport is, that you use good techniques. And then just in general, and it's heck, my golfers are a perfect example. I'll warn them, it's really probably not your golf swing you're going to get hurt. It's picking up your golf bag or things like that. And again, those common sense and deliberate motions can go a long way to preventing a lot of these injuries we see.
Yeah, and I think that's interesting you say that, and it's specifically in the area we're in, right? Because we do have a lot of retirees down here, and they really are professionals, right? You're playing pickleball or you're playing golf, 5 times a week. I mean, that's a lot. But I think it's
Right.
different than it was 30 years ago, right? I feel like the
Absolutely.
geriatrics of today, not to call our baby boomers or our silent generation even, were lazy, we're just had a different mindset. But I think people today are a lot more active in their we'll call it the last chapter of their life, or their after their next chapter, whatever you want to call it. They're much more active. They're out there. They're doing all these sports or these low impact sports where they can be involved. They can do all these things. So does that in turn mean you're seeing more cases because of that, or is it just always been that many cases? We just didn't tell. What's the statistics behind all of that? Because I can imagine we're seeing more, but not necessarily for the same reasons.
No, I think anecdotally in our county, we certainly see a lot more wear and tear injury types. I mean, the reality is a sport like pickleball. I mean, I don't think it's unique to me. I really wasn't very aware of pickleball until I moved to Palm Beach County. I think it just happened to coincide. I moved here 11 years ago, coincided with about the time you really started seeing it take off. And this is putting people out on an athletic court that some of them haven't been active in 15 years. And so that's definitely a microcosm of this new older generation that's not ready to sit on the front porch and just take it easy. They want to be out there doing their thing, and it's more than just swinging a golf club. It's pickleball, it's gym activities, it's doing things that on average are good for them, and it's certainly something I take as a goal for me in my practice. I think we as a field, we want to keep you out there. There's so many health benefits of you staying active, but it does come at a cost, and the wear and tear injuries, and that matriculates into our practices in our offices, and we wind up seeing and taking care of a lot of that. But it's important, and then some of it is managing expectations and helping people manage their conditions. And it's part of the talk I have with patients is sometimes finding what level of activity is okay for them. And this is a simple example. The person who has to recognize that I can play pickleball 2 or 3 days a week and everything's okay. A little aches and pains, but it's fine. But if I play 5 times a week like I was doing, my shoulder's killing me, or my hip or my knee or whatever it is. And that's a little hard for some people, and pickleball particularly generates this passionate love that people really get into it. And they go from not playing the sport to playing 5 days a week for 2 hours, and sometimes need to be a little bit more common sense in their approach to their sport to stay out of trouble and stay out of my office.
There's a warm-up period, right? Again, you can't just go out there and go think you're Messi or Ronaldo, right? And go play soccer. The same thing at any age, right? Doesn't matter, right? You have to warm up and you have to get into the swing of things, literally and figuratively, because if you don't, they're going to end up seeing you more quickly than hopefully they would have in the past.
Yeah, absolutely.
So what's kept you coming back to the industry? Because obviously 16 years is a long time. Imagine there's been changes, there's been updates. I can imagine there's things that are just the same that have been normal for the last 200 years, but what's kind of kept you coming back, putting those scrubs on, staying late, getting up early, and getting the job done?
Fortunately for me, I have the opportunity and the privilege to do a job I love. And it's not I don't know if I think about that every day, but there's not a week or a month that doesn't go by that I don't realize how lucky I am to have found a profession that I can maintain a passion for at 50 years old, this many years into it. And I think that's important. And it's not I don't know that everybody is fortunate enough to be able to put themselves into a position to have a profession like that. But I think it's important to try to find a job and a career that you continue to find enjoyment in and enjoy. I think, and it speaks to why I do this. If you look and see what I get to do every day, who wouldn't like it? I mean, it's fun at a level. We get to continue to see innovations and new technologies and get these tools and instruments and new techniques put in our hands. And it's a building and developing thing. And there are definitely things I do differently than I did 16 years ago. And it's a building and learning process, and you continue to grow through it. And that's part of what's fun about it. I mean, to not be doing the same thing over a 35-year career and see these changes and have to grow and continue to learn. It keeps you on your toes. It keeps you interested. It keeps you driven. Mm-hmm. And at the end of the day, when there's the two things I'm probably most passionate about is, one is actually the technical, seeing a job well done when you're finishing a case and coming out of it happy with the work you've done. And then just as important, a month later, 6 months later, with a patient standing in front of you saying, hey, I'm back to what I want to do. I don't have pain. I'm back. I've achieved the functional benefits that I want, and getting to see the gratitude and getting to see the results from the patient. And I mean, how can that not be rewarding? It's really something I really, really enjoy and love, and getting to see the results and the things that you're able to give back to your patients. I mean, that's great. That's what it's all about.
Yeah. And I think people who haven't been in that position before don't understand it. They'll never understand it. Right. And that's the whole point. You have to be able to get into it. You have to be a part of it, to just watch. And if you ever had somebody or a loved one, whether maybe giving birth or, like you said, going to the hospital for an injury or having orthopedic work done, be able to see them get back on their feet, literally and figuratively, how they feel about that person. It's similar to the physicians, right? Similar to medics, EMTs, nurses. These are people who genuinely want to see you healthy. Dr. Hinson wants to see you healthy. He doesn't want to see you. He wants to see you at your best. He doesn't want to have to see you come to him. But also, if he leaves you and you're better, that also is a great thing at the same time.
Yeah. We have a unique profession. We truly build relationships to end them. That's the whole point about what we do. You don't want to see me permanently. You want to get to know me, and hopefully it's done just in the clinic. And those patients, unfortunately, they have to go on to the operating room to see something fixed, repaired, replaced, and go on to get to a point where we're saying our goodbyes and you're going on with your life. And I think that's a unique and interesting aspect of what we do. And a little bit that we hate, and we have patients that we grow, deeply attached to and love and enjoy taking care of. And at some point we have to say goodbye to them, but that's the point. They want to go on to get back to the life they want to lead and get back to their loved ones and not be down seeing us and dealing with us.
Yeah, no, you're 100% correct. So, what questions should patients be asking? Because obviously before today, they didn't know about Dr. Hinson, or maybe you've not heard of him before. Now you know him, which means you have no excuse. You have somebody to speak with now. They're going on ChatGPT, or if they're older, they're just asking a friend maybe who fell and had the similar conversation. But how should they qualify or ask about physicians? Obviously, we talked about board certification being so important, But what are some other important things that we should be looking for?
Yeah, absolutely. I mean, I think certainly at the end of the day, the most important aspect of what we do is having the technical skill set to be able to deliver the care. And specifically in orthopedics, that includes truly the technical aspects of what we do in the operating room is we're repairing, replacing, fixing these problems for people. And the most important aspects of that, and some of them are a little hard to quantify, but people with some degree of experience, the people that have been doing this for some years, you don't have to do it, you don't have to be in practice for 20 years to really hone your skills, but the person has some experience, and it's a little hard to quantify and be able to identify who's continuing to advance themselves and focus on education, and the education meaning educating yourselves on what else and what there is new out there. But on the experience end, someone who specializes in that area and can say, yeah, I've done 150 of these this year, and something like a shoulder specialist who's in the reality is every surgery is different. There's some, and fortunately, there's plenty of them we do that that we have put to patients as kind of a day at the office case. I mean, the things that go perfectly smooth are relatively straightforward pathology and goes super smooth. But even those smooth cases occasionally have hiccups and things, and that's where the experience comes into play. The person who's doing that case 200 times a year can handle the really complex stuff and can really handle the easy, straightforward. Easy is not really probably the best word, but the straightforward stuff
Yeah.
that even occasionally has hiccups, that how to handle the hiccups and and have the flexibility and approach and the experience to be able to adapt in the surgery and address those things as they come up. And then at some point, and this is probably an even harder thing to quantify, you need to have the trust. And I don't know that there's really a way to do that without meeting somebody. And I try to take enough time with my patients where if everything goes smoothly, that's easy. You don't even have to hardly know your doctor. If you have come in with a problem and the surgery goes smoothly, it doesn't matter that much if you don't have a deep relationship with your doctor. When it really matters is when things are moving a little slow, or there's a hiccup, or there's some issue that you need some guidance. You need to have the trust that even when things aren't going totally according to plan, that this person in front of me, this surgeon, is going to do his best for me and care for me and lead me through this. And that's something you build in the clinic and with your relationships with people. And I think I've been fortunate enough over the years that even some of the patients I've been closest to are ones that had difficult problems and had a little longer recovery, because they could look to me with trust that, hey, this person's going to be there through all of my needs and listen to me and listen to my surgical and medical needs and even the life needs, which is part of what we do. And my number one job is taking care of your medical or your surgical problem, but recognizing what's your profession, what are your limitations on in them, how quickly we need to get you back to work, and those sorts of things. And we got to listen to the whole patient, not just we have a 1 centimeter rotator cuff here, how I'm going to fix that.
Yeah, no, you're right. So with that said, what are some rewarding moments of your career? Because I'm sure you're talking about all this relationships you're building. I'm sure you've had a few in your career that stuck with you. Tell us a little bit about that, because I think that shows the authenticity of you, which you
Yeah,
already are
yeah.
so authentic.
It's there's different kind of aspects to different aspects about what we do that can bring you high reward. We all love when you have a high level athlete that you get back to that high level, and I can think of different variations from youth baseball players to a college swimmer I took care of, and he stands out to me even though we didn't even do surgery on him. He came to me with a couple of visits and back to being a swimmer at Florida State and all conference, swimmer through the last couple of years of his career. After some simple care we were able to provide him. So yes, we love the reward of taking care of the high level athlete, but just as important are the simple, straightforward things. The 75-year-old retired person who's back, telling you, hey, I play all the rounds of golf I want to now. My shoulder doesn't bother me. I mean, and got through that repair and that torn rotator cuff I had. The things that are particularly rewarding are both the patients and the families that come back. I've seen one this morning, a gentleman that we did a shoulder replacement on. And I love the guy. He was very hesitant to do his first shoulder replacement. He's a very fit 70-ish-year-old guy who rode it out for a couple of years before he got it replaced. We replaced his shoulder. He's been nothing but happy with it, going back to all the activities he wanted to do. And now 18 months, 2 years later, we did his other shoulder recently. And what I like about that is he had the outcome and the confidence and the trust to come back to me and do it again. I mean, that really says a lot to me. And, building on that, the person who is bringing their wife to me, I have families that I've taken care of 3 generations. I mean, nothing says more about the level of trust than when you've taken care of a parent, a grandparent, and a grandchild in the family, and gotten to take care of all of those people. And I really, really, I love that and find that super rewarding. And in my practice, I actually make time to still see a little bit of general orthopedics because there's a lot of things we do that are just basic. The person who just sort of sprained their back and they don't need a spine surgeon, the person who rolled their ankle playing pickup basketball, and they know me because I've taken care of their shoulder. And what's fallen away in modern medicine and in our super specialized care is you have a shoulder doctor and a wrist doctor and a knee doctor and a hip doctor and a foot doctor, and you have to build all these relationships and have all these different people in your life. Then you come to us, and particularly some of these older patients we take care of, and they're 82, and we did a rotator cuff repair, shoulder replacement on them, and they know they have knee arthritis, and they just want a shot. And they can come in and not have to meet a new doctor. And they're like, I don't want a knee replacement. I just want somebody to give me an injection. And so I'll see some of those patients and be able to maintain those relationships. I mean, so the relationships we get to build is some of the more rewarding parts of this. So it's not as simple as one specific group or type of, the high level or the high, these crazy trauma cases that we get to do on occasion. All of them have their rewards, and all of them you carry with you as something that means a lot to you. And that's one of the things I really like about this is it's not the kind of last week's crazy revision total shoulder that you get some reward when everybody in the operating room and the people that are seeing this stuff all the time are going, wow, I've never seen that before, and so that's cool. I mean, that's fun. Yep. But just as rewarding as the person who had a really straightforward problem that we repair and get them back to everything they want to, and is as rewarding as like I said, the 3 generations of the family that the whole family trusts you enough to continue to bring back their family members to you. There's different aspects and different things that all of it brings real reward.
Yeah, and I love that. So I've heard that before from another physician we've had on the podcast. He talked about generations of families coming back to work together, to that trust that's been built. That seems to be something that, like you had said yourself, multiple physicians have said that to me before. So I say that as a great thing. That must mean that level of trust, between families is amazing. And part of that, I'm sure, is your leadership. And I know, you served as the president of the Georgia Elbow and Shoulder Society. And how does that really make any sense when I'm talking about trust with people? But it does. It talks about leadership. So tell me a little bit of your leadership and, kind of what you did to help that organization and help other physicians like yourself and, make them better, right? Make them as great as they can be practicing the medicine that they do love.
Yeah, absolutely. And I get the good fortune to spend 5 years in an academic medical center, and you get to, that part of the main thrust of that job is to be a practicing orthopedic surgeon and train these residents that are underneath you. And you really get to recognize that your body of work is going to get amplified. The guys that you train are going to go out and continue to build on your for lack of a better word, legacy of what you've done, and take what they learned from you and go instill it and practice and help other people out in the communities that they go to work in. And then on the professional organization level, like the Georgia Shoulder Elbow Society and the things we do here locally, and the things we do on education meetings, you go, the most recent one I was over in Tampa, and you're over there and you're teaching a class about certain techniques, and you're in a room full of high level learners. These are guys that are practicing orthopedic surgeons, guys that as you look around the room, many of the guys in the room aren't new looking surgeons. These are 50-plus-year-old men and women who are there to continue to build their practice, and to know that even as far as I am into my career, that I can continue to teach somebody else and give them tools to take care of their patients. that's awfully cool to be able to be in that position and to be a leader in the field and to get to continue to build upon what I'm doing locally and get it out there into other communities. I mean, that really means a lot.
And do you feel like it's influenced the way you practice your medicine? Because I feel like that would really help in a lot of ways. Like you said, you're building trust, you're teaching all these young physicians, you're helping, consult on these cases. Has that really kind of shaped you in your career over the last 16 plus years?
Yeah, I mean it does, and it, you ultimately wind up realizing that you need to hold yourself to a higher standard and really try to continue to grow yourself and your skill set. So whether it's teaching a young surgeon, whether it's going to do these education classes with guys that are well into practice and continuing to grow what they do, realize as you're continuing to learn yourself that I'm going to need to take these skills and take what I'm learning here today and be able to translate them into not just my practice, but teaching them to other people so they can also grow and also take what they're learning into their patient population.
Yeah, no, and it sounds like you are. I mean, mainly from state to state. I mean, that's amazing. So a couple of interesting questions I have for you. I call them rapid fire. I like to ask them on the physician side. Ice or heat? What's better?
I'm a bigger fan of ice, with the caveat that I will tell my chronic patients, meaning my patients with 6 months of pain, hey, if you like a heating pad on your shoulder, your elbow, whatever, that's fine. Ice is my go-to, but heat's okay.
But okay. Stretching or strengthening?
Yes.
50-50.
That was important, and the flexibility and the stretching is a huge component of protecting yourself. Particularly in high level, can even include something as simple as swinging a golf club. But the strengthening is vital. I touched on it on injury prevention in the midst of this talk. The maintaining strength, particularly as we age, is a very essential way to protect against injury.
Sleeping on an injured shoulder, no good?
No good.
No good. Okay.
That's an easy one, yeah.
Cracking your shoulder when you do that popping and you start doing all that. I know they say you pop your knuckles, it's just releasing of the air, but same thing. If people are sitting there like chicken wings, that's something they should be doing?
So it's a tougher question because it depends on the pop. And I get asked about shoulder pops all the time. Probably 5 times this week I've had somebody putting my hand on their shoulder now. Hey, what is it? And there are a lot of pops that are benign. And so it's tough to answer that completely, but there's a small joint up here, AC joint, that will crackle and pop, particularly as you age. And most people that are having some pop in there that doesn't hurt, tell them, hey, this is benign. It's okay. If you do this and it pops and you're not having other issues, not a big concern. But there are some pops and there's some things that are a concern. So it's a little hard to give a blanket answer to that question.
Fair enough. What's one exercise you wish more people performed correctly?
It's a little bit of a cheat when I answer this. I would say good technique with their resistance training, and that's probably the biggest mistake I see from my gym goers is lifting with weight that they're not able to manage well, and therefore have poor technique as they do it, particularly as we age. My emphasis, my focus, my encouragement to my aging weightlifters is, hey, you need to use weights that you have good control over and can use good technique.
Enough. And what is the most common question patients ask you?
Most common that's directly related to what I do is people ask me, why are you talking about my shoulder when my pain is down here? There's a lot of shoulder problems that are manifest with pain down over the deltoid to down into their arm, even though their problem here, rotator cuff, arthritis, a number of other conditions. So that's probably the most common that gets asked is people just not realizing what that means.
Okay, well, no, that's great. That's amazing. Well, Dr. Hinson, I have one last question, and I call it the only question I ask across all the spectrum. So every single podcast I always ask this question, not hard hitting, has nothing to do with medicine. But if you had to ask one person one question, whether they be dead or alive, does not matter, who would that one person be, and what would the one question you ask them be?
Wow. That's a a good one that I openly admit I wasn't prepared for in the least bit.
We try.
Yeah, no, thanks for that. This isn't hard hitting as you throw me the impossible to answer question. That's one where I think I'm going to have to punt because I don't immediately have an answer to that question, and it's actually going to leave me over this weekend. Sitting with a cup of coffee on Sunday morning, wondering exactly, take a rain check when they called Rudy one day, and you're going to answer the phone, and I'm going to be like, "Hey," and I'm going to blurt out a question. You're going to be like, "Who are you and why are you calling me?"
On the surgery, I wanted to give you a quick answer though. That's hilarious.
Sorry to give you the pass, but I'll think on that one.
No worries. Listen, we love as much time as you spent with us already. We know your time is valuable, so we appreciate it. So one thing, Dr. Hinson, is where can people find you? Because obviously that they resonated with you today. They heard your story. They heard about your bedside manner, which I think is extremely important in a physician. Obviously yours is great. From the conversations we've had, the trust you've been put in by your clients, how can they find you if they were looking for, treatment or looking to find somebody?
Absolutely. So my practice is Palm Beach Orthopedic Institute. We have offices in Jupiter Gardens, downtown West Palm, and Wellington. I actually spend time in the Jupiter Gardens, and I say Wellington. Our office is technically in West Palm Beach. It's on Southern Boulevard, just past the Turnpike. But we're in clinic 3 days a week, and I'm at all of those locations every week. Google us. We're not hard to find. You can Google me by name. You can Google our practice and track me down. But we're here and happy to help you with any needs you have.
Perfect. Well, Dr. Hinson, we appreciate you coming on today. Thank you for all your time and all the questions you've answered. It's been extremely enlightening, and I hope the viewers enjoyed it today just as much as
Thank you for having me. I appreciate it.
Thank you.